Hello, my friends, and welcome to the Pathway channel. Today, we will discuss one of the benign skin tumors. It's called the pilomatricoma or pilomatrixoma, and it's actually one of the most common solid skin tumors in children, and it happens on head, mostly head and neck. It is associated with activating mutation in the CTNNB1, which is the gene encoding for beta-catenin. The clinical picture for this tumor, it appears as a hard nodule with sometimes it might be painful. For the microscopic description, as shown in this slide, I'm now on the 2.5x, and I wanted to show you from this low power that this being said, it's a benign tumor, it's well circumscribed, as you can see on this slide, and it happens in the dermis. So this is our tumor here, and just for orientation on this low power, we have here the epidermis. It's not affected, and it's totally normal. And now we have this tumor arising from the dermis and sometimes from the subcutaneous tissue. From this low power, also I want you to appreciate, though we will go on a higher power, but I want you to appreciate that this tumor is composed of basaloid epithelial cells. And this is just from the low power. And I want you to see also that these cells, they appear here as this bluish color or purple color, but in the center you can see that these cells, they already died and now they appear as ghost cells, and this is a key feature for this benign tumor. So please note that these are important things to differentiate it from other lesions. We call these cells the ghost cells. So these are cells which are enucleated squamous cells. They will lose the nucleus and they are now enucleated and they are called the ghost cells. Sometimes these tumors, they have some calcifications, and it's again from this low power, we can appreciate this bluish area, which we will go on high power and appreciate more. These are some calcifications. I will just move around just to show you more of these calcifications. It happens here also. So if from this low power, we will just appreciate that we have a well circumscribed tumor. We have these basaloid cells, and these cells in the middle, they are just enucleated squamous cells, which we will call the ghost cells, or they have another name, the shadow cells. And we have these kind of calcifications that might happen with time. Let's go at a higher power. So I went directly to 10x because I don't think we need to go step by step and increase the power. So just to appreciate again, these are the basaloid cells we spoke about, and these are the enucleated squamous cells, which we call the ghost cells, and these are key feature for this tumor. And in the middle here, we can see some calcification going on. I want to show you another feature for this tumor, because these tumors, sometimes they are, the keratin irritate the tissues and they form these multinucleated giant cells or granulomas. And I will just search to show you one of these cells. I will go on a higher power just to appreciate this, these cells. So from this high power, we are at the 20x. I wanted to show you these multinucleated giant cells, which is mostly due to irritation or reaction to the keratin. So we can see here this one and multiple other ones. From this high power also, I want to show you that these basaloid cells that we mentioned on the lower power, it's a chance to see them at a higher power, though we can diagnose this from a lower power, but they have this vesicular or prominent nucleoli inside. So these are the nuclei, and they have these prominent nucleoli. So we can go on a higher power also to appreciate them more. So from this power, we have these cells. They are rounded nucleoli with this prominent nucleoli inside. And the ghost or the shadow cells inside, they are these cells which lost all their nuclei. The differential diagnosis for this tumor, as it has basaloid appearance, so the differential diagnosis will be the basal cell carcinoma, Merkel cell carcinoma, or pilometrical carcinoma. Thank you so much for watching this video. Please like and subscribe.